My name is Jason Pozner, and I'm talking about basic Botox. For my partner and I, this is the first in our series of basic talks for the consumer. The question is, what is Botox? Well, it's a purified toxin from Clostridium botulinum, which is a bacteria. This is the bacteria that your mother warned you about when you were a child that infected many canned goods. But don't worry, it's been highly purified since then. What does Botox do? Well, it's used to soften facial lines caused by muscle action. Is it safe? That's a question I get on a daily basis. Well, we've been using this product for over 15 years now for a number of medical conditions. It's approved all over the world. It's the most studied of the botulinum toxins, and it's one of the most widely researched medicines in the world today. And in fact, from statistics from the American Society for Aesthetic Plastic Surgery, Botox holds the #1 spot for procedures performed, with almost 2.8 million procedures performed by core specialists in 2007 alone. This doesn't even count what's performed by every spa on the corner and what's being done in the rest of the world. How does Botox work? Well, this is an example of your nerve, and this is an example of your muscle. When a nerve fires, what's happening is your brain sends a signal to the nerve, which then sends acetylcholine across this synapse into the muscle, which then causes the muscle to contract. What Botox does is it binds to the neuron, and after binding to the neuron, it prevents the acetylcholine release across this synapse, effectively letting the muscle not contract anymore for a few months. Now, where do you use Botox? Well, we use it for our frown lines and our glabella. We use it on the forehead lines. We use it on crow's feet. We even use it for Botox brow lift around the mouth and even around the neck. The glabella is the only place that is currently FDA approved for Botox use, although we do use it off-label on the rest of the face. This is an example of your glabella, and what happens when you frown is your eyebrows come down and in, and you form an 11 here, which is what you may have heard about. These are the muscles that cause frowning in your glabella. This is your procerus muscle, your corrugator muscles, your depressor supercilii, and the orbicularis muscle. These muscles all work together to help you frown. When you place Botox in these muscles at spots here, 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 and here, these muscles can't frown anymore, and the brow relaxes, lifting your brow up and out. This is an example on the left of a woman frowning. You can see the glabella muscles contracting, and you can see the 11 formed here. This is after Botox use. She's trying to frown, but she can't, and you see that the result is a much more relaxed look than in the previous photo. We also use it on the crow's feet to prevent these small lines on the outside of the eyes. We use it on the lateral brow to create a brow lift, and many patients come in for a chemical brow lift these days. We use it for brow lines, with these big lines across the forehead. And we also use them for platysmal bands, which when you squeeze your neck, you see these bands, so it prevents that as well.